in the opposition, particularly, for the people of Mansa, the people that you represent. Obviously, they voted for you. At that point, you are a sitting minister for them and a member of parliament for Mansa Central. But how's life been the past 3 months where they have a member of parliament, but not a sitting minister? Yeah, a member of parliament, but in opposition.
Well, thanks, Peter. The people of Mansa Central recognize that Zambia is a democratic state, and we respect the outcome of democratic elections. And so we, as people of Mansa, have recognized that the will of the people move towards electing the UPND Alliance into government. And so we elect to work with the government of the day and remain focused on the development trajectory that we embarked on. The development strategy for Mansa remains consistent. We will focus on access to universal education, health, and indeed all the determinants of health. Mm-hmm. We'll look at agriculture, and we'll look at infrastructure, that is including housing, roads, and indeed any other appropriate infrastructure. We'll look at empowerment of our people. And so the people of Mansa Central will remain focused on development, and we'll work with the government of the day to ensure we're not derailed in our trajectory for development. So we'll continue pushing our agenda for universal health access and education for all, and ensuring that all the other determinants of health, including nutrition, infrastructure, education, and all are pursued to the end.
How have the people of Mansa Central received the news of the proposal in the 2022 budget of a higher allocation in CDF from about 1.5 million to 25.7 million?
Well, I'm just from addressing the Constituency Development Fund Committee, and truth be told, the people on the ground are happy with the increase in the allocation for Constituency Development Fund. Decentralization should go beyond rhetoric and should be accompanied by increase in resources that are being spent at the grassroots. So the people of Mansa Central are content with the increase in CDF. Mm-hmm. However, we must state that we have noted that there will be a shift in responsibilities from central institutions more to the local government, and therefore the increase may not be adequate. So we have noted that we have to do more in areas of education, in areas of health, in areas of infrastructure, agriculture, and therefore it would be prudent to even increase it further.
Is it a good thing?
It's good to decentralize.
Yeah, because
it's good to increase the CDF.
Yeah, I want to find out from you because it's different when we talk about constituencies that are in the urban areas,
yes,
with so many facilities and everything available to them. But for a constituency like Mansa Central in Wapula province, well, it's a different story.
Going forward, we need to look at bridging the gap between the rural population and the urban population. And for us to adequately address the needs of the rural population, we need to, in the name of equity, appropriate enough resources for rural areas. And therefore, I'm a proponent of a situation where we have more resources for marginalized populations in the rural areas. And I believe that vast constituencies that are remote and that have got more challenges than urban constituencies should be allotted more resources than the urban constituencies. And so this is a matter that is urgent and must be considered as we go forward, in order for us to bridge the gap between the poor and the rich and between the urban and the rural populations.
There's been an issue, obviously, conversation around management of these funds. Do you have the capacity, the manpower, to actually manage this fund and make sure that it's allocated adequately to the responsibilities that have been passed on to the constituency?
First of all, decentralization is the way to go, and we need to equip the local government institutions with capacity in terms of human capital, in terms of in terms of financial resources to push the development agenda. You see, the country will only develop if we address key determinants of development. I always prefer springing from health because you must be born first before you can even be educated, before you can even become anything else. So key determinants of health are managed at local government level. And so if we empower local government institutions with capacity to address nutrition, education, health, infrastructure in terms of road, housing, then we're really pushing development at community level. So I am a proponent of decentralization with matching resources in terms of human capital and finances. Now, in terms of human capital, we're saying let us have local government institutions, councils, municipalities, district councils. Let us have a situation where we have human capital that is able to drive the development agenda. I'm happy with where we are today. We have town clerks that are qualified. We have planners that are qualified. We just need to ensure that we have a critical mass of technical people to manage the developmental process. And this way, we should be able to take development closer to the people. So decentralization is the way to go. Putting resources at local government level is the way to go. And we must match it with adequate human capital and adequate finances. So shifting responsibilities from central government to local government must be with matching human capital and financial resources.
Okay. You touched on one thing, health. I know you're a doctor by profession, so this is something that's very close to to your heart. And I want to go back to a time when we first recorded a case of COVID-19. You were health minister then. We fast forward to today. The world has been hit with another COVID-19 variant, the Omicron variant, which has seen countries imposing fresh restrictions, including travel bans. How dangerous is this variant, and how would you describe the management of the pandemic under the new Dawn administration?
I must state from onset that when we first confronted COVID-19, we were extremely concerned because it was the first time the world was being hit with such a virus. However, Zambia was positioned to address any public health threat because in our transformational agenda, we had included public health security as a top priority. So we created a framework for public health security by creating the National Public Health Institute, and it was geared to respond to any public health threat. So COVID was the second after cholera in terms of public health threats to be confronted by the National Public Health Institute. Our team was solid at national level and at institute level and also at the district level, provincial and district level. We set up an 8-pillar response where we looked at ensuring that surveillance was strengthened to detect new cases. We emphasized on testing at community level and ensured that we were able to pick cases quickly. And we went up to 20,000 tests per day. We ensured that human capital was adequately prepared to handle services across the continuum of care, beginning from surveillance right up to the end to treat. And so case management, we prepared adequate bed space, procured enough drugs, and ensured that we had adequate oxygen. And critically, we fought COVID at community level. We stockpiled for resources, for medicines and for other resources that are required to provide service across the continuum of care. But critically, we focused on community level interventions. COVID or public health threats are best prevented and not treated.
Okay.
Yeah, and therefore, our success in the first wave was informed by our ability to manage surveillance, testing, case management, stockpiling of commodities, health information systems, and also ensuring that we did not neglect routine health services. And we did well. The team ensured that morbidity was low, mortality was low, and we did attract international recognition when they assessed or surveyed 70 countries. We're the only country in Africa, and we're fourth in the world that was picked as the safest destination because of our management of COVID. So the team worked extremely well, and going forward, my view is that we need to learn lessons from where we're coming from. We said in January that the magic bullet towards the control of COVID was vaccination. We should have started earlier. We planned to start in February. There could have been politics around it, and we started around May or April, May. And the key that Zambians need to understand today is that people who are vaccinated have less likelihood to develop severe disease and to die. It's important to know that even while we are developing knowledge on Micron, which is a variant of concern, we have enough knowledge on previous variants such as the Delta. And we know that vaccination is the silver bullet that will ensure you are safe from COVID. So let us not derail ourselves focusing on the debate whether it should be mandatory or not mandatory. Let us sensitize the people. Let them know. People who are vaccinated will have less likelihood to develop severe disease, will have less likelihood to die. In fact, people who get the booster dose will actually have even sufficient protection from Omicron. So Omicron is a variant of concern, and we should not underrate it. While we have seen evidence recently reduced of easier transmissibility and maybe less virulence, we should also emphasize that there's a lot more that we're learning about it, and we should not underrate Omicron. It's got the capacity to cause illness, cripple our activities that should push towards economic reconstruction, and derail our economic reconstruction programs. So Omicron must be combated in the community by, one, improving vaccination from the current 10 to 12% to 70%. We must combat it by improving responsibility. Each one must take responsibility to ensure they are vaccinated, and then their families are vaccinated. And the stitching time will save you 9. Therefore, it is time to avoid factors that promote transmission. So crowded places must be avoided. There is no need for travel that is unnecessary. And it is important that we curtail transmission at community level by addressing the factors that fuel transmission. That is crowding, less travel, and ensuring that we mask up and wash our hands and just ensure that we prevent it, other than wait for a time when we are overwhelmed in our clinical facilities where we will need more human capital, more drugs, and more oxygen. We are best poised to fight COVID in the community.
Doc, I want you to be very honest with me. During the time you were leading, the Ministry of Health, there was a lot of politics surrounding the fight against COVID-19. Most of your political opponents, obviously, there was a school of thought that we as a nation cooked up these numbers that were being presented on a daily basis. Were these numbers cooked?
Extremely unfortunate position. You cannot defile science, and that's why I repeat, let's not politicize health. Health is apolitical. We need the nation to be healthy, to be productive. We cannot develop economically if our population is morbid, and we cannot alter numbers. We would be deceiving ourselves. And indicators in health do not lie. If you don't invest adequately in interventions at community level or at other relevant levels, the indicators will show. So we never cooked numbers. So I can tell you that when we got the first few numbers in Lusaka, we intervened at various levels and ensured that the numbers didn't skyrocket. When we thought that numbers were rising in Akonde, we shut the border. in order to control the epidemic within Nakonde, and we succeeded. When we thought Kafue was becoming problematic, we actually locked down Kafue for a few days, and we did massive testing and ensured that we controlled COVID there. Emmersdale here, where we went to foreign countries and got back with COVID here, we managed the community adequately. We had no business messing around with numbers. And the politics will kill people, because people will try to mislead others by talking about alteration of numbers, diverting focus from the key area, from the key issue of protecting lives. In health, we have sworn oath to protect lives, ensure that people remain well and contribute to economic development through being productive. So really, I want to emphasize here that we were scientific and we were spot on in our interventions as we managed the first wave. And this was recognized not only locally but internationally. Unfortunately, there are people who won't just applaud, but they would like to look at the negative side of things. Some people think that such success attract political mileage, and they must puncture it through negativity. And so these are the politics that will kill people. Let us unite. There are things that are Zambian. Disease must be confronted using a common front. Politicians across the political aisle must focus on a healthy population and ensure that Zambia is productive and healthy.
We were heading towards a very heated election, 2021. I know we saw you daily on TV. Give us his COVID-19 updates and how deadly COVID-19 is. Give us how many people we've lost in our communities or on a daily basis. Questions arose after we saw your president, our president at that time, President Galungu, commission projects, go out there in public, and wherever he went, there were huge gatherings. How then, or should I say, how easy was it for you, or how hard was it for you to have that conversation with the president, or did you have that conversation with the president to ask him not to go around, in public, gather these crowds? On the other hand, Wallace, you were fighting it head on, and people were trying to listen to you and question you at the same time, as in the behavior of the Patriotic Front, where they were gathering in large crowds when fighting COVID-19.
Well, political will is key in the fight against COVID-19. And I must state that I had support from the president as we fought COVID-19. I must also be honest and confess that there are many times that we may not have agreed with colleagues on interventions to stop COVID. However, overall, we had adequate political will in the first wave, and that's the reason why our performance was good, and we had low mortality, low morbidity, and political will is key to controlling COVID-19. And we must ensure that we do not expose our population to COVID-19 through large public gatherings.
Okay. Would I be right to conclude that there was political will backing you financially and support from the president, but his actions did quite the opposite?
Well, I wouldn't say you're accurate, but I would state that we had political will to fight COVID-19, and we got the result we wanted in the first wave. I'll not comment beyond the time that I was not minister. However, the coherence in our actions as a team could have been better in later waves that hit us to ensure that we could have had maybe lesser morbidity and lesser mortality.
You were part of the multi-secretarial team that was put together to come up with these measures that will help us fight this variant, and we saw the new government get voted into office. And in October, the New Dawn government lifted COVID-19 restrictions as, transmission of the virus had fallen. Was lifting of this restriction necessary when it was clear that a fourth wave was just around the corner?
Maybe a more cautious approach should have been adopted. You see, economic development anchors on key activities. And unfortunately, when you have a public health threat, That requires you to slow down movements, to slow down economic activities. You are flying straight in the face of your economic reconstruction program. So there must be a midpoint, a fine blend, of activity that will ensure the economy remains alive and the public is not put at risk of death. And so I urge a cautious approach. As we talk about lifting COVID restrictions, we should ensure that we find that fine point where we assure public health security and also economic development. And so it's a fine point that must be reached. And that's why I emphasize that we must always be alert with the evolution of the COVID-19 pandemic, and ensure that whatever actions we take are informed by the epidemic in terms of evolution. And we cannot protect the economy adequately if we are reckless with public health. And it is key that our economic reconstruction program recognizes the need to invest adequately in public health security. So by investing more in testing, in surveillance, we will be able to ensure that we shield the economy from shocks, because the surveillance team will be able to pick threats quickly and act before they result in lockdown of activities that should actually grow the economy. So economy rebuilding must always be done in line with or in close association with key interventions in public health security. That's why I look at public health security as a matter of national security. Okay. If you don't invest adequately in shielding the people from public health threats, you will expose the nation to epidemics that will push people back into inactivity and sort of reverse the same economic reconstruction programs that you've put in place. So it is fundamental to invest adequately in public health security. So it's not a waste of money to invest in surveillance, in testing, in keeping an eye for all forms of public health threats.
Okay.
Yeah.
All right. Before I move away from this conversation to do with COVID-19, obviously we had, the first vaccinations happen after you were relieved of your duties as, Minister of Health. But I want to find out from you if you have the knowledge regarding this. The outbreak of the virus has been blamed on unfair distribution of vaccines, with poor nations having, little or no access to these vaccinations or vaccines, I beg your pardon. What is the biggest impediment for Africa, to manufacture its own vaccines?
The world will only be a safer place for everyone if everybody is safe from COVID-19 and other public health threats. So the developed world cannot deceive themselves with public health safety if the poorer Africa or nations are not adequately protected from public health threats. Diseases know no borders. Human beings move. And you only have a safer world if everybody is protected adequately from public health threats. So in terms of COVID, we need to address the inequality, the poor distribution of COVID-19 vaccines. We need to have those who are developed and have financial muscle distribute or contribute to vaccination in the poorer nations. Addressing the inequalities will be key. So the world will only be a safer place if both the developed and the underdeveloped or developing world have equal access to COVID-19 vaccines. Travel restrictions are inadequate in this situation, but addressing the inequalities in vaccine distribution will be fundamental to assure a safer world. So my call is for the global stakeholders to ensure that we pursue universal access to vaccination against COVID and ensure that everybody is safe from this pandemic. Vaccination has been known as a key intervention in the control of various public health threats such as measles, polio, and really this novel challenge that we have today of COVID-19. Evidence is on the table showing that vaccines make a huge difference, and therefore denying developing nations access to these vaccines will be a big challenge. Technology is a huge problem. So we do not have adequate capacity in Africa to produce the vaccine.
Okay.
And we need to ensure that we forge partnerships with the West to ensure that we learn or we have capacity to produce vaccines that we can distribute to our people. And as we develop that capacity, let those that already have the capacity produce adequate stocks and ensure that all citizens globally are protected from COVID-19. For the world will only be safer if we are all safe from public health threats, including COVID-19. This is in the spirit of universal health coverage, and it's a matter of sustainable development. Yeah, and the world recognizes the need for a healthier population globally if we have to pursue sustainable development and combat poverty.
Okay. In case you're just joining us, you're listening to the Hot Seat Radio program in studio, joined by the Honorable Mansa Central Member of Parliament, Dr. CHILUFYA, joins us on the Hot Seat Radio program today. And if you're listening to us live in Lusaka, catch us on 87.7 right here in Lusaka on Hot FM. We're live on 93.3 on Kuitu FM, countrywide channel 912 on DSTV, and GoTV channel 301. You can be able to follow the proceedings. We're also live on our social media platforms on Hot FM Zambia. You can go ahead and follow the live link on Kuitu FM as well. You can follow that live link on those two social media platforms. We continue having this conversation with Dr. CHILUFYA. Now, Honorable President Hakainde Hichilema has, been consistent over his promise for, to fight corruption. And one of the institutions where people have been arrested over corruption is the Ministry of Health, where you served, which was under, your tenure embroiled in corruption scandals or allegations. Before we discuss the Ministry of Health, and I want to get to know who Dr. CHILUFYA is. What were you doing before you joined politics? How did you become what you are? How did you make it?
Well, thank you very much. Yes, my name is CHILUFYA, as you said, and I am a medical doctor with 23 years experience in practice. I graduated from the University of Zambia here, and I worked for various institutions in government, including University Teaching Hospital of Monze, Namwala, Iteji as a medical doctor for at least 5 years before I quit government to join the private sector. So in my 23 years practice, I worked for government for 5 years.
Okay.
Yeah, and I served at different levels in the health sector, and I joined the private, sector. Important to state that though I was working for USAID-funded organizations, I was seconded back, to government, though reporting to USAID-funded institutions, various projects. And so beyond being a private medical practitioner or medical consultant, I was also a businessman from the year 2005. And I only joined politics in 2011. And in 2013...
What business were you doing in 2005?
Well, I've done different businesses, Peter, and some you won't even believe. But
I want to hear them. That's why I want to get to know you.
Well, yeah. After running few tuntembas, both in Lusaka and in Iteji, I built my first lodge in Mansa in 2006, 2007, yes. I only became MP in 2013. So, Peter, if you think that I became a businessman when I became an MP, you're wrong.
That's why we're getting to know you.
I built
a question there. When you say tuntembas, do you mean an actual cantemba or you have these supermarkets?
Well, I'm not talking of supermarkets. I started very basic, and as I was working as a doctor, out there, I still was doing private, businesses, running little shops and so on and so forth. And when I left government, I escalated to another level, and I did build at least a 50-room lodge. in 2006, 2007,
Okay.
which I've been running to date. And so if you hear of Henry Court, it's a program that started in 2006, 2007, was complete and started operating. And in 2009, 2010, somewhere there, I also engaged with partners who were running CHILUFYA Marines, and started operating that facility, buying shares, gradually, and but started running it around 2009, 2010. And I have invested in various, businesses along the way. So I am first a medical doctor, a businessman, and then a politician. Yeah, and that's where we are. And it's important to state that I didn't join politics straight from the civil service. I joined politics from the street, as a businessman, and also as a private medical practitioner.
Okay. Let's get to the happenings of what transpired during your tenure. In 2020, the Anti-Corruption Commission arrested and charged you with 4 counts of possessing property suspected to be proceeds of crime, on which you were cleared. Were you getting money in your previous jobs to support your investments, or how much were you making to support your investments, that there were red flags that were raised in your investments in that marina, to be specific, because that's the one that that's the case that was taken to court?
Well, Peter, first I'll be cautious in commenting on this subject, because I know that it's a matter that is active in courts in terms of seeking compensation for malicious prosecution.
Yeah, but you were acquitted.
Yes, I was acquitted, and I just want to emphasize that commenting on the cases I was taken to court for and acquitted, being accused of having proceeds of crime worth 5.5 million kwacha, when just my earnings from Parliament were 7 million, was absurd. And beyond that, as a businessman, I had other sources of income, and the statement did show what I had gained along the way. And I also had loans, some of which are even in public domain. So all I'm saying is that I had adequate capacity joining politics, and it was political to actually drag me into those cases, because I became a businessman way before I joined politics. I'll not comment on the case that is in court today, because that would be contemptuous, but I'm commenting on the cases that I was accused of, and can only conclude by stating that as a medical doctor, I worked in government up to 2005, and then was a businessman and private public health practitioner, all the way up to the time I joined politics, and I only became an MP in 2013.
Okay.
So you can conclude from there, and then we'll discuss more after the court case is over.
All right, now stay away from that case, since you're seeking compensation from there. People want to have, or want to hear from you directly, tell your side of the story. Because coming back to the Minister of Health, we heard of scandals, in the manner things were being handled, including gaps in the handling of the COVID-19 donations, and, the honeybee scandal involving the procurement of expired, or shall I say defective, drugs and condoms, among many other things. What is the truth behind this story? Because I know it got its day in court, but we didn't get to hear testimonies. Nobody did get to testify. We heard about the acquittal. We saw the technicality in which you and the others that were accused were acquitted on that technicality. So we want to hear the story from you, Dr. CHILUFYA. What's the truth behind this story?
Peter, I want to emphasize that first, I'm a trained medical doctor, certified medical practitioner of medicine, and I have never and I will never expose people to expired drugs or to leaking condoms. I swore oath to save lives, and I've spent my 23 years either saving lives or building health systems to save lives. And therefore, I would never be reckless as a certified practitioner of medicine and a doctor who took oath to expose the public to expired drugs or to leaking condoms. Politics that insinuate these are the ones that will kill people, because people may shun medicines thinking they're expired or condoms thinking that they're leaking and then die because they have no access to these key interventions. I want to state that in my tenure as Minister of Health, we never procured expired drugs. We never procured leaking condoms. And anybody who has evidence to the contrary must be put to strict proof. We shouldn't defile science for political expedience. We can't sacrifice medicine at the altar of politics. And it's important to be factual whenever we deliberate on these matters. You see, the public is gullible, and some people take what they read on social media and in some media, whatever they read as true. Mm-hmm. So when you scream loud and say people were exposed to expired drugs, look, you are polluting the public perception of the health sector. And it is important that we recognize the imperative of factfulness when we're talking science. Zambia has, like many other countries in the world, have a very solid and robust pharmacovigilance system. We have an institution called ZAMRA, that looks at the safety of medicines and medical supplies and medical allied substances, the issue of adverse reactions to medicines. So the system is solid enough to avoid exposure of the public to drugs that are expired or condoms that are leaking. We inflamed the nation with such statements: expired drugs being consumed by the public, leaking condoms being used by the public. There is no proof anywhere that this is happening. You see, the world has set standards. There are World Health accredited laboratories that will be used to ascertain the quality of drugs, the quality of medical allied products. So if there's a dispute, when you have a challenge, if there's a dispute with any product, there's a contractual obligation to get a third party and ensuring that you test in a WHO accredited laboratory. I challenge anyone here to bring us results from a WHO accredited laboratory that state that Zambia ever procured expired drugs.
Are you discrediting the lab tests that were done here in Zambia?
Which tests, Peter?
By ZABS. Because we got the stories from there. They gave us the report to say, after they tested, some condoms were leaking. We saw videos of them testing those condoms, those leaky condoms. Issues to do with these drugs. Did they expire after they were taken into storage, or were they expired at the time, they were procured by the ministry? Because you flagged them off. They arrived in the country a day later. We saw you flagging them off to be distributed.
Well, so I don't know about a day. I don't know about a day later, but I want to, and I'm not a spokesperson for ZABS.
Okay,
but all I'll tell you is that in my tenure as minister, no expired drugs were procured or distributed or dispensed to the public. No leaking condoms, and any institution in this country that claims that they were leaking condoms should be put to strict proof. And we know that there are results in public domain from WHO accredited laboratories that assure the quality of the condoms, the gloves, and that report on the quality of the drugs that were brought in. Like I said, politics should never pollute science, and factfulness is imperative, and therefore you can claim all you want to claim, but bring the evidence on the table. So let the Zambian people have closure on this subject. It is important that anybody who cries foul and says that these drugs that were procured were expired, or that these leaking condoms were expired. Let them come to the table with internationally accepted norms and say that this is the situation. I challenge them. And I'm stating here that the collusion of political players, competitor businessmen, and strategically positioned civil servants to create false narratives in the public domain just to tar the image of certain individuals in the conscience of the public was regrettable, must be investigated, and must be punished. Because we cannot inflame the nerves of the nation with false reports just in the name of settling political scores.
But what happens? What happened to those drugs that were recalled? Because there was a recall of drugs.
I will tell you.
There was a recall of those condoms.
This is
are you saying that we after the tests were done, as a nation, we recalled medicines and condoms that could have been used and were very, very okay for public consumption?
Peter, let me spend a few minutes to talk about pharmacovigilance.
Okay.
Every year, globally, the Americas, Europe, Africa, they record drugs that may have certain challenges unforeseen in specifications. This is just like you hear that Toyota Japan has recorded vehicles, or this company has recorded its products, and the like. It is a surveillance mechanism meant to ensure that the public is not exposed to products that don't meet specifications. Now, not meeting specifications, maybe for various reasons. It may be an error at manufacturing level. It may be an error that happened in transportation. And when the system is alert enough to detect that, they will recall. That is extremely different from getting a drug that was supposed to be consumed by December 2019 and it is being supplied into December 2021. It's expired. So surveillance for safety of commodities to be used is done in medicine. It is called pharmacovigilance. Surveillance that looks at adverse reactions for drugs that we utilize at facility is recognized under pharmacovigilance. Now, what I'm saying here is that while we look at products as they come in, we even go further. We look at products as we utilize them. If there's an adverse reaction, we have forms that we fill in and we investigate. Anything that shows any challenge, any threat to health, we recall. Now, it's extremely important to choose words correctly. When you talk of expired drugs being dispensed, you're talking of drugs that cannot be used because their shelf life is done, and therefore they are now toxic. When you talk of a drug that does not meet specifications, either because there was an error in a one batch or two batches out of 100 batches, and you recall them, that is surveillance for safety. That happens globally, and every year, Europe, America, Africa recalls drugs in that line. It's called pharmacovigilance. It is not criminalized. You should ask yourself a question: why it became pharmacovigilance in the matter of that you're talking about became an issue. And that's what should raise your index of suspicion. While I'll tell you that go to any institution in this, go to Zamra, go to health, go to medical stores, go to the Ministry of Health, and look at how many drugs, how many medical products we recall annually, including donations we recall annually, based on our alert surveillance that picks that this may not meet particular specifications. These don't come to the public domain. And we wanted to create a particular narrative. That's why we politicized the issue of the drugs and the condoms you're talking about here. So I want to go on record and state that this country, at least under my tenure, no expired drugs were procured. No leaking condoms were procured. And it's contractual for you to ensure that you involve a third party, mutually agreed, if you question the quality of the product that you bring in. It is contractual.
What was
we
the shelf
cannot
life?
defile science for political expedience. And what I'm stating here is that Zambians must have closure. They've never been exposed to expired condoms. They've never expired drugs or leaking condoms. And it was all procured. It was a procured narrative.
I know.
And we must investigate it.
Doc,
and
I know, we can pick our words carefully here and say not expired, but what was the shelf life of those drugs that you flagged off that raised alarm at the end of the day?
Well, I'll tell you.
What is the shelf life of drugs that we get? What's the standard? If you were leading the Ministry of Health, if the Ministry of Health is procuring drugs and I'm a supplier, say I have these drugs, what's the standard at the Ministry of Health? What's the shelf life supposed to be for those drugs procured?
Well, I'll tell you honestly here that a health center kit will have more than 50 commodities. And all those 50 commodities will have different shelf lives. It depends on what molecule you're dealing with. And I am not able today to tell you individually what was the shelf life of each commodity. And I must just tell you that we do not procure drugs that have short shelf lives. It's one of the red flags.
When you say short,
short shelf lives.
Let's put a time limit to it.
You cannot bring
Is it 4 months? Is it 2 weeks?
It's a red flag to bring in a drug that expires next month.
Okay.
You can't bring in a drug that expires the next 3 months. We must ensure that we do our quantification properly to ensure that what we need to supply the citizens in line with the disease burden is what we quantify. So we have technical teams that are skilled to ensure that to quantify and to ensure that they do their projections and they do procurement. That's a totally different area. It's a whole new area, and I can talk about it as a technocrat and politician, but it's not a matter that is under my jurisdiction as a politician. Yeah, all I'll tell you is that we have adequate capacity in the Ministry of Health, in our technical teams, in our technical departments, to ensure that quantification is appropriately done, and projections of what we need to utilize is properly done. And my role as minister is outside the purview of these quantifications, projections, and procurements and the like. But as the overall head,
the buck stops with you.
Yeah, as the overall head, I can assure you that I don't have reports. I never had received reports on my table of expired condoms, expired drugs, leaking condoms, and I can stand today firmly, head high, and say that let us not decoy the population from the successful transformational agenda that the ministry underwent under our tenure, where we built infrastructure to push towards universal health coverage, more than 500 health care facilities, primary health care facilities, more than 6 specialist hospitals, the first medical university, where we reformed healthcare financing, coming up with the National Health Insurance Authority, and today out-of-pocket payments are being challenged, where we have a framework for health security, and National Public Health Institute is ensuring we're all safe from cholera and COVID, where we have all the supply chain matters addressed through a decentralized system. We repealed the Act, the MSL Act, and formed ZAMSA, created a drug fund, and ensured that we shifted procurement to ZAMSA, where we ensured that health indicators, maternal mortality, child health, HIV, TB, malaria were improved. And all these are on the wall for all of us to see. So we posted deliverables, our transformational agenda towards universal health coverage, our reset agenda to health care, where we looked at the whole continuum of care from promotive to curative, preventive, curative, rehabilitative, palliative, was on the wall for all to see, with indicators improving appropriately. We cannot decoy our people from these by looking at carefully choreographed negatives.
For just saying this was just like an attack on you.
Yes. And I'll say that we should, in all honesty, address we address matters to do with our democracy. You see, our democracy is only as strong as our institutions. So we should avoid lawfare.
Who attacked you, Doc?
I am going to state generally here, and I will not defame specific individuals, but I will state generally here for politicians across the aisle that we hold power in trust for the people, and we need to ensure that we protect our citizens, all citizens, and we should ensure that our institutions of governance are not manipulated just to suit a specific political agenda. And I'm saying here that in all honesty, as we battle politically, internally or externally, we should avoid the use of the law to create a particular narrative to blemish the image of particular individuals, to push particular agenda. I hate to see the politicization of health. If you want to tar the image of someone in the health sector, you want to sloganeer about expired drugs which don't exist, you are insulting the professionals in the health sector. That's a system that ensures that there is no procurement of expired drugs. If drugs expire on the shelf because we no longer use them, that's totally different from procurement of expired drugs. And I'll tell you honestly, if we have drugs that are new on the market and they've got better efficacy, as in, for instance, HIV drugs that will reduce viral load, improve CD4 count in a relatively shorter period compared to other drugs, we'll transition our patients to newer molecules. Now, if you find those drugs not in use for a year, there should be a budget to get rid of those medicines. And that happens. So to politicize it and try to get political mileage out of it is wrong.
Okay.
And all I'm stating here as I conclude on this subject is that let us not defile science. Let us not sacrifice health or science at the altar of politics.
So you will not be specific on who actually was attacking you, whether it's in.
I will tell you that this is a very strong cartel of politicians,
so my question
competitor businessmen, and strategically positioned civil servants, and the subject of another day.
I'll just ask you this to just zero in on specifics by myself. Was it a PF internal fight?
I will not shy away from telling you that the internal squabbling within the PF contributed significantly to its loss. And I will not shy away from telling you that the PF committed suicide. And I'll tell you that we could have done better by focusing on the positives that the party posted, other than fighting individuals who just worked hard to push the president's vision and who wanted to push the development agenda for the people.
Okay.
Yeah.
My next question will be, why did President Galungu fire you? If you gave him this explanation that you just gave us.
Well, I'm a man under oath, and I will tell you honestly here that my letter of dismissal had no reason. And the appointment to a political office is the discretion of the head of state. The disappointment is his discretion too. He doesn't need to give a reason. But the protection of my professional integrity is my responsibility. And I will allow anybody to take away a political responsibility from me, but not to tamper with my professional integrity. That I shall fight with the claws of a lion.
Okay, in case you're just joining us, we have Dr. CHILUFYA on the Hosted Radio program. We're live on 87.7 here in Lusaka, live on 93.3 in Lusaka surrounding areas, as well as DSTV channel 912, GoTV channel 301. The PF is going through a rebrand, and so many people, so many individuals are positioning themselves to, take over presidency or any other position, Secretary General. We've had those positions that have, that are available. Which one are you vying for, Doc?
It's not so much of what position I'll be vying for. It's so much about what the people see in individuals within the party and who they want to be their leader. And I think we must all be magnanimous to respect the will of the people. And so, people will decide who they want to be their leader. I am content to serve as an MP in Mansa Central, as a member of the Central Committee of the Patriotic Front Party, as a leader in the country, and if I'm called upon to serve in any particular position.
Okay. So you have no ambitions whatsoever to lead the PF?
I am saying, and I repeat, it is not so much about what I want. It is a lot about what the people want and what qualities people see and what people request each of us to take up. So I am available to serve in any position that the people of this country would want me to serve.
All right, so how are you taking the rebrand process? Because we know that...
well, we just need to be honest to each other and ensure that where we need to be truthful to each other and think we made mistakes, we must be open. Where we think we were toxic and we fought each other, we must have a truth, commission and reconcile genuinely. And we must do an honest reflection, sober reflection of what transpired and then, rebuild.
Is that possible?
Playing around with, words like rebranding, with being rhetorical about rebuilding, won't work. It's important that we reflect, we have a deep and sober reflection of what transpired, and agree honestly to address honestly, what went wrong, and that is what will be called rebranding. And we will not do well to deny what was happening. So if there was corruption, let us scorn it. Let us frown collectively upon corruption. If there was cadreism, let's frown upon, cadreism. But we must ask ourselves questions and demand honest answers. And we must be magnanimous to address all the challenges that we face if we are serious about rebuilding. Otherwise, it's a futile exercise.
Just from what you've said, I can tell your tone still hints at divisions in the PF, where you had this introspection as a PF, and you came back to the public and said, listen, we've heard what you've said. You had these questionnaires go around the country where people said what they were unsatisfied with when it comes to the PF. But it seems like this fight is more, or this rebrand is more internal than external. Because I want to bring your attention to a certain popular, what should I call it? You used the term earlier on. Is it a clique or
cartel?
A cartel, thank you, called Luapula United. And you were rumored to be the lead of this Luapula United that was supposed to take over the PF.
Those were the falsehoods, that, characterized, our existence. There was nothing like Luapula United.
Have you had open conversation about this Luapula United?
Well, we need to have open conversation about it. But what was Luapula United? I never participated in any meeting or forum that was called Luapula United. And I can tell you that was a hoax. And we need to confront lies in politics. Let politics be a battle of ideas. And I'm talking about politics, practiced across the aisle. Let us battle about ideas, and let us focus on developing the nation and making the country a safer place for everyone, and we combat poverty, we combat disease, and ensure that we move towards sustainable development. And as we ply this trade, we must raise the moral standard and shy away from lying. We cannot be creating, perceptions or procuring narratives just to settle scores. No. Issue of Luapula United just never existed. If you ask me, it was a hoax, like many other hoaxes that led to various wrong perceptions about the party and government. Because sometimes you get into this situation where you think that by tarring the image of Peter, you are destroying him, yet you are destroying Hot FM. So you must ensure that you look at the bigger picture. So I am an open person, and I'll tell you that we need to honestly introspect and not rubber rouse about what happened. We must face the questions squarely and demand honest answers of ourselves consult broadly with, broadly with the grassroots and other stakeholders, and ensure that we come up with the real reasons why we are where we are today.
Okay.
And if we won't do that, then the rebranding, process is a mockery.
Well,
it must be informed by evidence, it must be a scientific process.
Okay, clearly there's a bigger conversation to be had in the patriotic front from what you just said. And I love the fact that you're being very, very honest about it. And that conversation needs to be had among, regarding all these issues that we've raised today. As we bring this program to a close, I know we started a bit late. Unfortunately, I have to apologize to our listeners this morning and our viewers that I will not be able to open the phone lines for you to actually ask Honorable CHITALU CHILUFYA any questions today because of time. We're already running, past our broadcast time. We started the program slightly late. But I'm going to end with this. President Hichilema has launched a fierce battle against corruption in Zambia. And so far, a number of former government officials have appeared either before the DEC or the ACC for questioning. What's your take on the fight against corruption?
I will not defend corruption. I'm a proponent of the fight against corruption. Only it must be methodical, it must be surgical, and institutions must operate without undue influence. It's a message to all of us politicians who were in power yesterday, who are in power today, who may be in power tomorrow, that we should assure justice for all citizens. Our democracy is only as solid as our democratic institutions. So we cannot afford to manipulate institutions. So I will support the fight against corruption. Only we must be surgical and ensure that those that indeed committed offenses are brought to book, not those that we perceive as political threats. And this is a message to the previous regime, to the current regime, and to regimes coming ahead. We hold power in trust for the people. We must be accountable and ensure that justice is for all. And we cannot afford to adulterate these institutions. It's for this reason that I said in my maiden speech in Parliament that I applauded President Hichilema's statement when he said he will reward honesty and frown upon honesty. Because there are institutions that are clad in constitutional immunity. Therefore, the individuals serving those institutions must be honest, must be above board, and should not be manipulated by anybody. And there must be a palpable distribution of power amongst the three arms of government. And we must ensure that every citizen is assured of justice. And no Zambian will criticize the fight against corruption as long as it is done along those principles I've spoken about.
Doc, I'd like to thank you very much for coming through to the Hot Seat Radio program this morning.
Well, Peter, thank you very much. And I will emphasize, I'm a medical doctor who took oath, and I'll never expose Zambians to expired drugs or leaking condoms. Let's keep politics away from health.
Okay.
Yeah. And those who thought they would push me into a political oblivion using those lies have drawn a blank.
There you have it, Dr. CHITALU CHILUFYA on the Hot Seat Radio program this morning. We're live on 93.3 FM in Lusaka on Kwitu FM and live on 87.7 in Lusaka on Hot FM. Until next week, Thursday, or until this week, Thursday, I beg your pardon, it's goodbye for now.
That was the Hot Seat. Don't forget to join next week at the same time. Exclusive to Hot 87.7.